Hey everyone, I'm Darlene, Cosmetic Coordinator here at the Park Clinic for Drs. Chris Park and Ryan Rebowe. I have Dr. Park with us today. We're going to talk about vaginal rejuvenation. He's going to be able to answer a lot of questions that are frequently asked, and hopefully this will provide answers for you to see if you're ready to come in and have a consultation with one of our doctors here.
Yeah, so we're trying to do a better job of letting people know that there are things we can do to enhance the vagina. It's not something we're going to put a big section on the website or anything like that. And so I feel bad that a lot of patients just may not realize that there are a series of things that can be done. So if anybody's ever not happy, hopefully they ask enough questions and figure it out, and then we're happy to see them in person and go over it. But essentially there's kind of three components to the vagina to consider for improvement. One is the internal vagina, the functional part of the vagina, and then on the outside of the vagina there's the inner portion which we call labia minora and the outer portion which we call labia majora. And all three of those entities can have their own issues. We mainly treat most commonly the labia minora, so that's the inner portion of the vagina that either from birth or puberty or sometimes later on with childbirth or trauma. If you have a tear or something like that, the labia minora can hang a lot longer than a woman wants it to. It can be both aesthetically unpleasing, but also can be painful. So if that portion is hanging down and folding over on itself, it can impact you during sexual activity, but also normal daily stuff like exercising, biking, horseback riding, those sorts of things. And so what we tend to do is a very precise, careful labiaplasty where we are going to remove the portions that we don't want, still maintain enough to keep moisture and all the daily function of the vagina, and also to make it prettier. I usually end up tailoring it up towards the front of the vagina, which we call the introitus area, around the clitoral hood. We don't mess with the nerve to the clitoris or any of those sorts of things, but we're going to make all that area tight and youthful and prettier. And so it feels better for a lot of patients.
Great. Tell me a little bit about the procedure. Is it a very detailed procedure, or?
So yes, to me the labiaplasty is a nice little procedure that is very detail oriented in my opinion. There are some bad reputations of labiaplasty when people do just a straight up amputation technique, which is a horrible word in that area, I know. But a lot of times there are techniques where you literally just remove it and let it heal on its own, which is not very pleasant. When I do a labiaplasty, even though it's a small area, just a few inches, I mean it's about an hour and a half long procedure. Removing it is the easy part, but putting it back together how you want it is a very fine, delicate procedure. I use a specific type of sutures. I use 4 different types of sutures. Each one does a different layer, and it's all absorbable, no stitches to take out. Mildly uncomfortable. I do strongly prefer to do patients asleep, just because of where not even the pain, we can numb it, and we do numb it. Even when you're asleep, we numb the area up. It just, nobody wants to have me down there working for an hour and a half so delicately. So we do it asleep, which is very pleasant. It's got some tenderness, but I would put it very mild on the recovery scale of pain. We do restrict the things I mentioned, so straddling of any way, shape, or form, both sexual and physical activity, for 6 weeks to let things heal. And it usually heals beautifully. Occasionally a few areas might open up just a tiny bit because it's not the cleanest area in the world, but I've never had to surgically deal with the problem. There just may be a couple small areas that take a couple weeks to heal.
Okay. What about sensation? Is there a chance of losing sensation to the area?
Very, very remote. I mean, like I said, the procedure is carefully designed to preserve the nerves that we know we need, and the glands and the sensation, the moisture is even more important. We definitely stay away from the clitoral nerve, which is the most important nerve, but all that does remain should be totally normal and sensate as well. The inside of the vagina does not have sensation ever, and so those areas are sometimes addressed as well.
What about childbirth after vaginal rejuvenation?
It's fine, totally fine. I mean, it may stretch things out a little bit, but I've never seen one that actually required another repeat labiaplasty.
So you've talked about the inside of the vagina. Tell me a little bit about the outside of the vagina. What can be done to address issues or concerns from a patient?
So there's 2 main problems you might see with what we call the labia majora, which again is the outer triangular shaped, hair-bearing, in its native state portion of the vagina. And occasionally it's too large or too loose or large, full or tight, but in some way or shape or form it's too much. We see that a lot in patients that lose weight. So if you used to weigh 300 pounds and you had a sleeve surgery, now you're down to 140, 150, that area sometimes doesn't shrink up enough. And so just like the rest of the body, we oftentimes have to do some contouring of that. And that would typically involve, if it's just full but the skin is nice and tight, you can just do some liposuction. There's actually a fatty layer in that area. If there's too much skin, then we do an excisional procedure, more on the outside portion, so you're not into the functional portion of the vagina, and just remove it, and with or without liposuction at the same time. The more common thing we see just in almost every woman at some point in their life is it becomes atrophic, or you lose that fat layer that we talked about, and we actually want to fill that in, and we can do that with fat grafting. So we can take fat, can take it from anywhere. Most commonly I'll take it from the inner thighs because it's in the immediate surgical area. Most women want liposuction of their lower tummy and their thighs anyway. And we take that fat, we remove it, and we process it by a variety of ways, essentially getting all the fluid out and just leaving the little kernels of fat, and then we inject that into the vagina. In the outer portion, and it should add some volume. We're going to overcorrect it a little bit, and it's going to swell a lot. So the first time a patient sees it, it looks like too much. About a week, it's starting to look, maybe looks good, but a little too full, and then some more is going to go away. And it should fix it without really any scars at all.
What is the typical downtime for this procedure?
That one's just more of a soreness issue. So it's going to be real sore and kind of hurt to sit, and it's going to get black and blue, for about 2 or 3 weeks. And then the liposuction will have its similar kind of process.
Another question that's frequently asked is, what about the inner part of the vagina?
So yeah, the inner portion of the vagina has multiple things that can be going on. It can contribute to incontinence if things are atrophic. You can lose moisture and have dryness of the vagina, or it can just feel like it's too loose or stretched out. We as plastic surgeons oftentimes will let the OBGYNs do most of that. We certainly know how to do it all and can get involved, and sometimes I've helped the OBGYNs, but we like to have your OBGYN involved before we do too much on the inside. There is some technology out there that also can be looked into that is in either laser or radio frequency or ultrasound, just to kind of tighten things up internally. It's temporary, but a lot of women find it helpful.
So if a patient realizes that there's something they want addressed, do they call you? Do they call their OBGYN? How do they proceed once they decide to have it evaluated?
I think that's one thing that we pride ourselves on, and the reason you're here is, we're happy to see anybody. We're happy to educate. We're happy to tell you, what we think you could do, should do, whether we do it or it's something we don't do. We're happy to do it. So nobody ever needs to feel like they're wasting our time. In terms of trying to save the patient time, I would say basically, if you can see it and you don't like it, that almost applies to anything in your entire body. We can talk to you about it. There's no reason to be embarrassed about this. We do have to obviously examine the area. We do that very briefly. Just make sure we don't feel any masses or problems or scary stuff. And then we'll just talk about what we can do. So yeah, in general, labiaplasty and the discussions about it are fairly straightforward. We're going to remove stuff you don't like. We can add fat back if we need it. And it's overall a fairly simple process and a fairly simple and not too painful of a recovery. So we're happy to discuss it. Just give us a call anytime and we'll do a consultation. We are doing a lot of virtual consultations right now during COVID. I wouldn't say this is probably the best procedure to do virtually, but if somebody wishes to start that way or is more comfortable, we never mind. And we don't charge for the virtual consultations if you're just not even sure you're starting in the right direction. So just give us a call or email or however you want to get in touch with us. Thank you.